All right, so here we are again. My name is Jeff Connor. I'm the development officer
Mhm.
with Stepping Stone Emergency Housing in Anoka, and I have with me Julie Jeppson, our executive director. And we just kind of wanted to get together again and give a quick update to all of you folks out there on what's going on at the shelter. So I guess, Julie, we talked about 2 weeks ago now. Lots
Right.
have changed since then.
Yeah.
What are some updates you'd like to give folks with what's going on at the shelter as of this time since our last conversation?
Yeah. So there's been two very large changes that have happened. Over this past weekend, about half of our residents moved into a motel. We worked very, very closely and very, very well with those at social services in Anoka County to get this process put in place. And so over the weekend, as I mentioned, about 22 of our residents actually moved into a motel in Anoka. And so the point of that was for social distancing, which has been very successful. So now we've always had 66 residents in our shelter, and now we only have about 30. Some of them have voluntarily social distance, so we are holding some of those individuals' beds for them until the stay-at-home um, directive by the governor lifts, and now that's May 4. So we're holding those beds for them. The other 30 are staying at the shelter, and then we have those at the motel. And so that's been great. So over this last week and early this week, we've kind of divided our staff up so we still have the same expectations and programming and services provided, meals and all that kind of stuff in both locations for the same number of residents.
Oh, wow. So they're half the residents have went to the hotel, but Stepping Stone is still kind of the overarching umbrella, I guess, if you will, for those residents there. And we're still supporting them as they strive toward that self-sufficiency, the 3 meals, the all the toys. So all the needs are pretty much the same. We've just gotten some help from the Anoka County. Thank you very much, Anoka County, for your help with that. And so the mission still is the same for those 30 or so residents that are at the hotel as if they were living there at the shelter.
Exactly. Exactly. Yep.
Awesome.
Yeah. And
What?
the other big thing that has happened since we last spoke is we've had four residents start showing symptoms of the virus. And so, in response to that, we have put those individuals into quarantine and isolation. But an unknown result of that that we couldn't have predicted, in hindsight, was probably something we should have predicted, but we didn't, is the mental health issues that go along with being in isolation. And for those of us who have a home, who don't have a diagnosed mental health issue, being in our home isolated, which we're all kind of doing right now as it is with stay-at-home directive, we can muscle through. But for someone who is on the brink of a mental health break or suffering with severe mental health issues, putting them in isolation is very, very difficult. And so with those four individuals, one of who has moved to the motel, so he's out of the shelter. But for those three other individuals, they have had a very, very hard time with that. One woman, all three of them have left because they couldn't handle being isolated.
Hmm.
We need people, we need community, we need support, we need interaction. And being in isolation, even though you're in a shelter, that's not possible.
Yeah.
So what I've started to do two things. The first thing is working closely with Mercy Hospital, Alina Health System, and they've been amazing. Thank you, Alina Health, for your help and getting those individuals who show symptoms tested as soon as possible. We are our residents and our staff are considered one of the priority groups for testing, and so now when an individual shows signs of symptoms, we will get them tested as soon as possible. But the other issue that comes with that is transportation to get them tested. And so coming up with creative ideas on providing transportation for that potentially sick individual to get tested has been a hurdle. So working on that. But there's still days, between when the symptom shows up, when we're aware of the symptom, when transportation is resolved and figured out, and when test results come in. And so there are days that those individuals will still need to stay in isolation, that they need some support. They need some mental health services. And so now working with Anoka County and our other mental health service providers and getting them the real help that they need during this time also has to be a priority.
Wow, that's amazing. And yeah, much appreciation to Mercy and Alina for helping out and their willingness to help out these our fellow human beings during some times of need. And I can speak for myself, just being isolated. And I know a lot of my extroverted friends are really struggling with this isolation right now. And frankly, I just can't even imagine what it would be like to be in shelter, isolated even more, because of the COVID. So
Yeah.
super happy that we're able to get some resources to those folks to help them through this. Just I guess as a last question to our conversation, Julie, what kind of needs are there? Are there new needs that have popped up because of the social distancing and the stay-at-home orders? How can folks out there watching this who are looking for ways to take a little bit of control in their own lives and show, and one of the best ways that we know to do that is by getting out of our own heads and thinking about other people. So what are some ways that people could connect with us to share some of their energy that they now have while they're staying at home?
I think just a continuation, Jeff, of what I'm experiencing right now with our community, in that they're reaching out. They have donations to provide. The financial donations that are coming in are incredibly generous and so needed right now. With this motel model and our shelter model that it is now, we're able to increase capacity because the hotel has more rooms than we are able to provide at the shelter. So with more rooms being filled and more residents going into the motel, we are going to need to be hiring more staff to accommodate our programming at that other location. So funding is essential right now, so that we can hire that staff, so that our residents get the care and the attention that they so desperately need.
Wow, that's, one of the things that I know I always try to do, and we're always admonished to do during times like this, is to look for that silver lining, look for something positive in something that otherwise would be viewed as a negative situation. And to me, it's amazing that this COVID-19 crisis that we're in is actually opening up an avenue to move some people, 300, and I think the last time I heard 357 on our waiting list.
Oh,
Um,
it's well over 400 now.
yeah, I figured it had grown a lot since
Yeah,
the last I'd heard.
yeah,
So the fact that we can then tap into that even more than what we had been prior to this, I
yeah,
mean, that's a silver lining worth mentioning and celebrating a little bit. And it just shows how important it is for folks out there and to just keep that funding coming. So,
yeah,
if folks are looking for a way to help and a way to help other people, this is an excellent opportunity, and our reach is now expanding, which is just incredible to me
yeah.
that we're able
Absolutely.
to do that. And I thank you for your leadership and positive outlook through all of this. It's been amazing to watch, and I'm excited to see what the future holds for us, quite frankly.
Absolutely. Well, thank you for the kind words, Jeff. And I just want to say, it's really easy for me to have these phone conversations and coordinate efforts with all these professionals and service providers and funders and things like that. But really, at the heart of it, it's our staff that are showing up every single day and doing their job, knowing that they may be exposed to this. We had a resident who works like 9-hour days, 6 days a week, I think, and she got a letter from her employer that one of her colleagues has tested positive. And so Now you're knowingly in the possibility of this virus in that situation into the shelter, and we still have staff that show up every day, do their job, knowing that they're helping where help is needed the most.
Wow, amazing. Well, Julie, thanks a lot for joining me on this. I know that this is some great information that the viewers are going to enjoy seeing and learning about. Again, can't thank you enough. And I'll look forward to our next conversation, hopefully in the next week or so, and we'll just kind of keep going with this.
Me too. Thanks,
All
Jeff.
right. You bet. Have a good day.
You too.